Hello and thanks for joining us. I'm Lynn Doyle. Welcome to this week's Meet the Doctors. We have a great lineup of doctors for you today to talk about the latest health news and medical breakthroughs and how they may impact you or a loved one. Please understand the medical advice given on this show is not intended for anyone individually, and that we always suggest that you check with your doctor before making any medical decisions. Now for the latest headlines. People enduring chronic leg and back pain usually resort to the most common treatment, steroid injections. Now researchers say a randomized trial shows that these injections, which is a cocktail of steroids and an anesthetic, do almost nothing to alleviate inflammation for those suffering from what's called spinal stenosis. The study of 400 patients was published in the New England Journal of Medicine, and scientists concluded that doctors and patients should be considering alternative treatments. This is important because hundreds of thousands of these painkiller cocktail injections are given each year, thereby costing hundreds of millions of dollars to the patient. Well, we're well into summer now, and no doubt that lawnmower has been put to good use. But did you know that more than 800 Americans a day, yes, 800 a day, are treated for injuries suffered while cutting the grass? According to the U.S. Consumer Product Safety Commission, last year alone, more than 300,000 people were treated for lawnmower-related injuries, either in a medical clinic or in the emergency room. And parents, beware, because more than 10,000 of those injuries occurred in children younger than 18 years old. There's good news for chocolate lovers. Dark chocolate may actually ease the pain in walking that some people experience. Baby boomers who have difficulty getting around because of poor blood flow to their legs, it's called peripheral artery disease or PAD, they may now actually be able to walk a little longer and a little further after eating dark chocolate. People who ate dark chocolate were able to slightly increase their time, and scientists believe compounds known as polyphenols may have something to do with the improved blood flow. See, it does not work, though, for those of us that love milk chocolate. British scientists have identified a set of 10 proteins in the blood that can possibly predict the onset of Alzheimer's, an important step toward developing a test for the incurable, devastating disease. To get more information on this disease that affects 44 million people right now and will possibly double or triple in the coming years, let's go to our South Florida studio where Newsmax Deputy Health Editor Nick Tate is standing by. Nick, it's good to see you as always.
Good to be with you, Lynn.
This, to me, just seems like it should be screaming headlines all across the country that there could possibly be a test that could predict the onset of Alzheimer's.
It really has been a holy grail of medicine to come up with a test that predicts Alzheimer's, because there really are no definitive early warning signs for Alzheimer's. And what happens today, because there's no real treatment, there's no real cure, is that by the time people have symptoms of memory loss and other symptoms of Alzheimer's, by the time that happens, the drugs really can't do very much to help folks because the disease has already progressed. But if you could do a blood test, in as simple a way that as you now do cholesterol testing, that would identify whether you are at risk, you could get those drugs sooner and they could do more good.
What kind of impact would that have on families where Alzheimer's runs in the genes, where it runs in the family?
Well, you know, they say Alzheimer's does not just affect individuals, it really affects whole families, caregivers. Many spouses provide the care for someone with Alzheimer's, children, close family members. It really changes your whole life in ways that you really cannot anticipate. So it would be a tremendous benefit. It would not only extend the lives and allow people to maintain their memories and their personalities if they are at risk for Alzheimer's by slowing the progression, but it really would have a tremendous effect on those families. Something like 1 in 10 Americans over the age of 80 or 85 is at risk of developing Alzheimer's, and it is the 6th leading cause of death in this country. So it costs a lot of money, hundreds of billions of dollars in health care, and in addition, the toll on families is just immeasurable.
You said it absolutely perfectly, because it's just so emotional when someone that you know and love slowly disappears in front of you. How will we know if we can get the test? Can we go to our doctor's office at this point and ask to test for these proteins to see if they are present in our bloodstream?
It's really too early yet. This is really just the first step in identifying and creating a test that you could get in your doctor's office. And in many ways, what the real benefit of this finding is researchers that have been testing drugs, something like 100 Alzheimer's drugs have been tested over the last 15 years. All of them have failed, and one reason that researchers believe that's the case is because the individuals that were taking those drugs had already had Alzheimer's developments, Alzheimer's damage to their brains, and so the drugs that were experimental could not be effective. So this test might allow researchers to identify those people who could be tested with future experimental drugs that will lead to those treatments, possibly even a cure. So it's still too early to ask your doctor for it, but we do see that in the next couple of years being a very strong likelihood.
Finally, it's just great news to hear that there's progress being made, because those numbers are startling. 44 million people, and that number expected to double or triple in the coming decades. So I guess we can say that while it might be too early for us to get the test, at least progress is being made.
Absolutely true, and the hope is really, there's such great hope for it. The issue, I think, is that as the number of boomers turn 65, something like 10,000 Americans every day are turning 65 in this country. As more older people grow, this disease is becoming even more prevalent.
All right, Nick Tate, always great information. We'll talk to you later in the show. We'll take a short break right now, but when we come back, we'll have our featured takeaway on just how many Americans are hooked on painkillers. Stay with us for that and much more as Meet the Doctors continues. Welcome back to Meet the Doctors. You know, it's shocking, but prescription drug overdoses kill more Americans than heroin, cocaine, and other illicit drugs combined. In fact, we use more painkillers than any other nation on the planet, and families are being ripped apart by it, as Governor Rick Scott of Florida knows firsthand.
Well, I have a brother that's been on drugs all his life. I don't talk to him about it, so I don't know. But I know he's been in. He's ended up stopped by law enforcement a lot. He's been in a bunch. I've put him in a variety of psychiatric programs, and to this day, it hasn't worked. Look at how many people are dying in this state. Over 7 people a day are dying of drug overdoses. And I've had drug abuse in my family, and it's just devastating. It
is devastating, not just for the governor, but for millions of families all over the country. To give us a better understanding of this epidemic is Newsmax Deputy Health Editor Nick Tate once again. Nick, it is heartbreaking to see how many millions of families across this nation are impacted by drug abuse.
There's no question about it. It is a huge public health problem, and we now experience in this country about 46 people every day die from a prescription drug overdose, primarily to painkillers, which are very easy to get. All anybody needs to do to get a painkiller or heavy narcotic is to walk into a doctor's office and say, I'm in pain. Give me a painkiller. There isn't a test like a blood test for high blood pressure or cholesterol, and doctors in many cases are all too eager to prescribe those meds.
I actually have heard the term doctor shopping, and I think I understand what it is, but maybe you could explain it for us.
You go to doctor shopping refers to the practice of an addict, say, going to one doctor and getting one prescription and then going to another doctor and getting another prescription. And so this is how they can build the supply of meds that they have. And that's one of the reasons that people OD, is they're getting drugs from multiple doctors. Now, in places like Florida and other states, they have created databases that allow doctors to check a patient's record and see if they've received other prescription drugs in the past. If they have, it strengthens the doctor's hand in saying, well, I'm not going to give a prescription to this person who just got one yesterday or the day before from another doctor. And that's one reason why in the state of Florida there's been a drop of about 23% in the number of drug overdoses since they put in place this database that allows doctors to check, which really cracks down on this doctor shopping practice.
Doctor shopping is one term. Pill mills is another. Define that for us.
Pill mills are places that routinely just bring patients in and churn out the supply of meds. There are a lot of places that have reputations where even addicts from other states know they can come and they can just they're just churning them out. You see them lining up outside the doors before they even open, and they really become kind of mills for the dispensing of these meds. It's one reason why in this country we do use more painkillers than any other country on the planet. Something like 110 tons of painkillers are prescribed in the U.S. every year. That's enough for every man, woman, and child to have at least one bottle of meds on their medicine chest, and a lot of people just believe that's too much.
I'm one of them. I can't believe it. That when you put those numbers out there, it just seems unbelievable that Americans are that into prescription drugs. Nick, I want to thank you very much for being with us and giving us the information that you usually do. It always enlightens us. We're going to talk to you later in the show, I understand, as well. So we'll talk to you in a moment, but right now we want to bring in our Newsmax contributor and wellness expert, Dr. Erica Schwartz. Nice to have you back with us.
Thank you. Nice to be here.
So you heard Nick say that this is an epidemic in this country. You're a physician. Why are doctors so willing to write those prescriptions?
I'm sure it's a lot more complicated than that. Yeah, doctors, unfortunately, are trained to write prescriptions. And I remember as a young doctor that the doctor, one of the senior doctors, told me, you know, when you go into private practice and you have a patient coming in, all they want is for you to write a prescription. If you're not going to write the prescription, they're not going to come back to you. So while I'm perfectly willing to blame the doctors and blame the pharmaceutical industry for being so overly, abundant and creating such a huge demand by advertising directly to the public, and the doctors not knowing what else to do because they're trained by the pharmaceutical industry, I think we should also look at ourselves, because we, as patients, ask for the prescription.
Is there a particular kind of painkiller in particular that people ask for more frequently?
Yeah, of course. There's, the OxyContins, the opioids, they're called, Vicodin. Everybody knows about it. And, and it starts from high school. And it's like, as Nick told us before, it's worse than the combined cocaine and heroin problem. And so the thing is that we're allowing our children, as parents, we're not supervising them enough. And then once people get hooked on it, yeah, the opportunity is there. There are the pill mills, there are the drug, the painkiller, problem. Oh, I have a pain in the back. Just to get you out of the office.
So
here's the prescription.
I'm your patient. I come in, I tell you I'm having a terrible knee pain or my shoulder is hurting. What would you do to test to make sure that I truly am in pain? Don't you have to have faith and trust in your patient?
I think you should. And I think the most important thing is to coach your patients first and then to look for the results. So that's not the way we're taught in medical school. What I think is you examine the patient, you talk to the patient, you develop a relationship with the patient. And then I think as far as prescription, there's a lot of room before you get to writing a prescription for something that deadly.
Are you suspicious if I come in and I ask for a particular drug, I say I want OxyContin?
You better believe it. I've never written a prescription for OxyContin ever in my life, and I wouldn't. This is the thing. When somebody comes in and they complain about a pain, you can examine the patient. You can get this history of the patient, and you can tell a patient if they're doctor shopping. And you know what? In this environment of insurance, getting paid nothing, the doctor looking to make a buck, literally, writing a prescription may be their only way of making money that day. So you're looking at a really disastrous combination and confluence.
We have to take responsibility as patients too.
Unequivocally.
To make sure that we don't become over dependent on it. I know when I had my knee surgery, I wanted to make sure that I didn't take too much because I didn't want to get addicted to it. So I'm sure you see that all the time.
All the time.
All right. Thanks, Dr. Erica. Good information as always. We have to take a quick break, but when we come back, we'll answer the question, are generic drugs safe? We'll be joined by Dr. Chauncey Crandall with that answer and more. Stay with us. Welcome back to Meet the Doctors. I'm Lynn Doyle. You know, as we baby boomers age, many of us are taking a variety of life-improving medications. But asking the doctor to write a prescription for a generic drug may save you money in the short term, but not be the best thing for you health-wise in the long run. I want to see what our friend Nick Tate thinks about that. Nick, when I talk to my doctor and he says, well, do you want me to write a generic prescription or a name brand drug, what should I answer?
It's really becoming a more complicated question. You know, generics have been pushed to a great degree in this country, and they now account for about 90% of all medications that are taken in the U.S. But most consumers really have no idea what's in the medications that they're taking, and there are new questions that are being raised about where some of those medications are being manufactured. The FDA has banned imports from several companies in India, which supplies about 40% of our generics because of manufacturing problems that have put patients at risk. So it's really becoming a more difficult question, and you really need to talk to your doctor about whether a brand name drug, depending on what you're taking, is a better option than a generic and a safer option than a generic.
Is this also a conversation that we could have with our pharmacists? Are we able to ask the local pharmacy owner where he gets his drugs or what manufacturer is making these generic drugs?
You can ask, but the truth is that a lot of the chain drugstores buy in bulk, and they buy from India, they buy from Pakistan, China, Iran. Your pharmacist may not, in fact, know. It's not just that consumers don't know. Many pharmacists, many doctors themselves don't know, and it's very, very difficult to find out. The other thing is that the FDA does allow for different levels of active ingredients, ranging from between 80 to 125 for each pill. So you may be getting more, or you may be getting less in your generic than you would get in a more carefully controlled brand name drug. So a lot of questions there really that are hard to answer at this point.
It's difficult for patients to make an educated decision because insurance companies sometimes won't pay for the brand name drug. They encourage their insured to actually use generic, and yet the generic might not actually be doing the job that the brand name could be doing.
The thing to know about this is a step prescription where insurers will require you to take the first step of trying the generic first before going to the brand name drug. In most cases, the insurers will honor it if your doctor will say, in this case, the generic does not work, the generic is problematic, and we need to go to the brand name drug. Your doctor can be very helpful there in moving directly to a brand name drug, but you need to know that you have to position your doctor to do that.
Thanks, Nick.
Thank you, Lynn.
Joining us now is cardiologist Chauncey Crandall, who is also editor of the Heart Health Report for Newsmax magazine and who's also featured on Newsmax.com. Dr. Crandall, so nice to have you with us.
Thank you.
We're
Enjoy
particularly grateful to have you since I understand that you've just come out of surgery.
Well, I've been in surgery all day and I just came from the hospital.
Well, we appreciate your time. Tell me what you think about this report comparing generic drugs to brand name drugs. Which one would you recommend to your patients?
Well, you know, I always try to put my patients on brand name drugs. The generics are starting to give us a problem, and I'm very concerned about that.
Why are you concerned? What kinds of problems have you witnessed?
Well, some years ago, I had many of my heart patients on a special heart drug that became a generic drug, and after going on this drug, many of their hearts started to fail. I couldn't understand really what was happening until I saw this failure repeating in many patients. I put them back on the name brand drug and their heart failure disappeared. So this led me to believe that there is something going on with generic medicines that we need to be concerned about.
Have you witnessed problems with other drugs or just those that are related to the heart?
Well, you know, I use cardiology drugs most often, but there are other drugs that we are beginning to see problems with. Many of these are epileptic drugs to treat epilepsy.
Boy, that would be something that would be horrible for a patient to be taking a generic drug and start to have additional problems.
Absolutely. You know, this is a deep concern of mine, and I want to emphasize to the viewers that if at all possible, you need to go on a brand name drug.
When you say if all possible, is it sometimes, as Nick and I were talking about, the insurance companies that insist that the insured use a generic brand instead of the brand name just because of the cost?
Well, the insurance companies, the VA medical system, and the government want to push you to generic drugs because it lowers the cost of medicine. And this is a big concern of many physicians today, that generics are not equal to brand name drugs.
As a patient myself, I can tell you there's a daily medicine that I take, and I swear when they put me on the generic version of it, I felt different. And my doctor said to me, it's exactly the same thing. It's like buying corn in a can that has the grocery store name on it instead of Del Monte. I definitely felt a difference. Would you tell your patients or anyone who's watching this show to really encourage them to point it out to the doctors if they do feel like it's different?
Lynn, I would encourage all patients to take the name brand drug. There is a difference when we take generics, and it can cost the patient his life. So at all costs, I would urge the viewers to pursue the name brand drug with their primary care and do everything in their effort to get that name brand drug through their insurance company.
Doctor, do you think this is something that is going to find its way to our elected officials? Should we be making a noise in Washington saying that we want to protect ourselves, we want to remain healthy and not be at risk? Is it something that either they or the FDA could monitor?
Absolutely, and I think we need to make our government officials aware of this. They are pushing you to inferior drugs, and we need to get a revolution going to get these inferior drugs off the market. They're already in the VA hospital, and many of these patients are receiving inferior drugs compared to name brand drugs.
I'm certainly glad we had this opportunity to talk to you about this. I hope that people are watching and that they will take the actions that you suggest. Thank you so much. You're going to stick around, right, and answer some email questions from our viewers?
I will, absolutely.
All right, we look forward to that. In the meantime, we're going to take a break, but when we come back, we're going to talk about baby boomers suffering from ADHD. Not their kids, the baby boomers. Stay with us. Welcome back to Meet the Doctors. I'm Lynn Doyle. So if I said the words attention deficit disorder to you, you'd obviously think it was a children's disease or a children's problem, right? Well, not necessarily so. Baby boomers are actually being treated for it. And here to tell us more about it is Dr. Prakash Masad. He's a former professor of psychiatry and behavioral science at Duke University. He now practices psychiatry in New York City. It's wonderful to see you.
It's good to be with you, Lynn.
Let's talk about attention deficit disorder and what exactly it is.
So then, attention deficit hyperactivity disorder is a disorder characterized by two constellations of symptoms. There is the inattention, and then there is the hyperactivity. So the inattention, people have difficulty staying focused on tasks. They cannot complete tasks. They'll start an activity and stop it midstream. They cannot really have structure in their life. They're very disorganized. Their desk will be a mess. They're very forgetful. They always forget to do things. Their wife says, "Can you pick up some milk?" And they forget it. They lose their keys. So that's the inattention part.
But when we hear about that, we usually associate that with a child, particularly the second part of the description, which talks about that constant movement.
Absolutely. The hyperactivity part, as you rightly point out, is much more common in children. So children are fidgety, they cannot sit still, they blurt out answers when they are not asked the question, they on the go, as if like a motor is running inside them. But in adults, hyperactivity is less common. Inattention is much more common.
So it actually is occurring not only in children, but adults. I have to ask what might seem like it's an obvious question. Are the kids who had it when they were children now having it as adults, or is it an onset in a whole new group of grown-ups?
It's the former. So the adults had ADHD symptoms when they were children, usually starting before the age of 12, but it just continues into adulthood in approximately half of children.
Is it continuing into adulthood because it was never diagnosed and never treated when they were kids?
Probably a little bit of both. So there are going to be kids who are treated for ADHD, but they still have a persistence of symptoms into adulthood. And then there are lots of people who were never treated as children who are treated for the first time as adults.
And we look at them and think, why can't they get their act together?
Exactly.
Right?
Exactly.
We're
exactly.
like, you're a grown man, you ought to be able to have your desk cleaned, or you ought to be able to pick up the milk, as you said.
Absolutely. I mean, you know, if somebody is your colleague or your employee, you say, why are you so disorganized? Why can't you complete your tasks? Why can't you get your work done in time? But, you know, sometimes they choose professions where it's easy to get away with inattention.
So how do you first diagnose it, and then how do you treat it in adults?
So the most important thing about diagnosing it is to get a good clinical history. In adults, you usually get it from the patient themselves. In children, you can get the parent, you can get the teacher to be the informant. In adults, it's difficult, right? Because it's difficult to interview a colleague, it's difficult to interview maybe a spouse, you could do that. But the clinical history is the key to making the diagnosis of ADHD.
So once you've made that diagnosis, then what do you do to treat it?
So there are two treatment options. There's either medications or some form of psychotherapy. Usually cognitive behavior therapy is the psychotherapy that's helpful, but most patients will benefit from being on medications.
There's been a lot of controversy about the medication, particularly when it applies to children. There's been some report that people put kids on drugs way too soon, that they're just going to grow out of it. Is that same controversy following medication for adults?
Unfortunately, adults are very undertreated. So less than 15% of adults who have ADHD receive any treatment whatsoever. So the problem that we often run into in children, where we say, oh, stimulants are being overprescribed, they're being over-medicated, it's actually not a problem in adults at all.
Now let me ask you this, because so many times when people get to a certain age, the forgetfulness, the inability to complete a task, the, oh my gosh, where are my keys? How do we know that we're not just suffering a midlife, premenopausal, postmenopausal episode as opposed to having ADHD?
You know, that's an excellent question, and I'm as guilty about it as anybody else, being forgetful, being kind of distracted, not paying attention when somebody's speaking to you. The key to the diagnosis is a longitudinal history and having the constellation of symptoms, and the symptoms have to be present in more than one situation. So not just at home, also at work or in social activities. So it's really a good history is important, and you have to rule out other diagnoses, right? Because somebody may have a depression, an anxiety disorder, substance abuse. They're very common in adult ADHD patients.
When do you recommend that they come and see someone like yourself?
If somebody is having problems with inattention that's interfering with their functioning at work or at home, and it's kind of really not allowing them to reach their full potential, they should get an evaluation.
As always, we encourage people to seek out their doctor's opinion, but you have given us a lot to think about. Oh, I'm sorry, were you talking to me?
Yeah, thank you very much.
No, thank you so much. I hope you'll come back and talk to us again.
Thank you very much.
We have to take a quick break, but when we come back, it's your email health questions that are going to go to the front of the line. We're going to answer all of those and much more. So please stay with us here on Meet the Doctors. Welcome back. This is one of my favorite parts of the show, when we actually get a chance to hear from you and to answer the questions that are most important to you. Joining me now is our Newsmax health contributor, Dr. Peter Hibbert from Florida, and also here in the studio with me is Newsmax's wellness expert, Dr. Erica Schwartz. Okay, so you guys good to go? You want to answer some questions? Sure. Let's start with you, Dr. Hibbert. It's nice to have you back with us. Our viewer wants to know how they should be treating juvenile arthritis. And I have to ask a question, why would someone who's a little bit older be suffering from juvenile arthritis?
Rheumatoid arthritis is a inflammatory disorder of joints. The adult onset and the juvenile are distinctly different types of diseases. Both are immune mediated, and some of the juveniles get better as they go through their teenage years, and others have troubles with progressive disease. The trouble with dealing with arthritis is you're dealing with a joint destructive process if you just ignore it some of the time, not all the time. And it's always wise to get involved with specialists who specializes in joint diseases when you have these kind of serious immune-mediated disorders.
Okay, we have another question for you from our viewer that asks, how is bipolar disorder treated today?
Bipolar disorder is a genetically inherited disorder where you have your moods. Bipolar means you have the highs and the lows, both. If it was unipolar, you may have either the lows by itself or the highs by itself, and then you go back to in the median range where we all like to think we all sit. Bipolar situations are very disturbing for the victims in the sense that they lose total control of their ability to control their thought process. If they're going through a hypomanic or up phase or manic phase, they may do things that are completely illogical and not in keeping with what anyone would seem to be normal. And likewise, in their depressions, they can be so deep as to become seriously suicidal also. So bipolar patients have wonderful medications available to mood modify and prevent the spikes from low to high from occurring as often. And for that, you need to have your doctor's guidance, often with the addition of a psychiatrist helping you.
Okay.
These are hormone-mediated situations. Counseling by itself is inadequate.
We do always want to point out that while we appreciate the advice and the observations of our doctors, that you should really always consult your own physician before making any decisions. Our next question is for Dr. Erica. This viewer would like to know if diabetes drugs have some bad side effects.
Like all drugs, they have bad side effects. But the big problem with diabetes is that it is of epidemic proportions, as we know, because of the obesity problem in America. And so before we even go to the drugs, we should go to the idea of eliminating diabetes by decreasing the obesity epidemic. So eating well, the problem with diabetes drugs is that they increase insulin resistance, and they actually create more problems with people trying to lose weight while they have diabetes.
What do you do when there is a side effect to a drug that you're taking?
You stop the drug. It's the first thing. Mm-hmm. And people always call and they say, well, I've been taking this antibiotic and all of a sudden I have a rash and I've been still taking it. Don't. It's your life. You make a decision. If you think something's wrong, stop taking it. I mean, most drugs that you take for acute problems are not going to be a problem when you stop them. It's for stuff that you take chronically, like antidepressants and medications that make you really addicted to them, that you have to do slowly to take them off.
Okay, let's go back to Dr. Hibbert. This one asks, how should I treat my lymphedema?
Tough nut. Lymphedema occurs when we have two return circulations, if you want, of fluids. One comes from the vein with blood coming back from the periphery, and the lymphatic system actually takes care of. It's an immune-mediated. Let's say it's an immune drainage system, if you like. the lymph nodes serve as sentinels to kind of catch the lymph as it's circulated back and goes through the chest and the thoracic duct areas. Lymphedema involves a very difficult situation, usually of lower limbs, but you can get lymphedema also of your upper limbs. For instance, after a woman's had mastectomy, radical mastectomy, where they're taking the lymph nodes out, lymphedema in that affected extremity is very common. And a lot of our lymphedema treatments involve our physical therapists with massage and certain drainage procedures. We don't have good drugs to treat lymphedema at the moment.
The next question has to do with drugs. It's for you, Dr. Hibbert. Are drugs the only way to lower our blood pressure?
Certainly not. Your blood pressure is a factor of your diet, your weight, and your genetics. And when you add all them in, sometimes we even take foods and medications that also adversely affect our blood pressure. So, do you have to take medicine to have blood pressure managed? The answer is not always. However, if you have hypertension, you are at risk for significant problems. The major things are renal failure, strokes, and heart attacks. I mean, this is the forefront of not treating. If you're a young person with hypertension, you're probably wiser to see your doctor, affirm the diagnosis, make sure there's nothing correctable going on, and then they may put you on some blood pressure medicine until your lifestyle corrections that may take months to take place are accomplished. And as that happens, your medication will be weaned back if it can be.
All right, thanks very much. And now for Dr. Erica, why has back surgery actually made me feel worse?
Well, it depends on the person, obviously. And in this case, if your back surgery has made you feel worse, obviously the surgery did not accomplish its goal. So before you have back surgery, you want to make sure that you've exhausted all non-surgical means of getting rid of your back pain. Exercise being a very important thing, not just being, stressful, strenuous exercise, but exercise that stretches your back so you don't wind up in bad situations. And if the back surgery has made it worse, unfortunately, it's too late. So what happens is you don't want, before you have any kind of surgery, actually, think twice. Make sure you've exhausted all options that are non-changeable.
But finally, if this person is still in pain, would you suggest that they seek
Take a
out a different
painkiller.
doctor? What do they do? How do we help them?
Well, so this is it. Going back to painkillers, this is the thing. This is how we start the addiction and the cycle. Because a back surgeon who's done the back surgery that has not been successful will then send the patient to a pain doctor.
So we have to be very
And
careful.
so we have to be very careful, and we have to take responsibility.
Okay, Dr. Erica Schwartz, thanks so much for answering our questions. Dr. Peter Hibbert, good to see you as well. If you have questions for us, please send them to us. We'll do what we can to answer them. In the meantime, stay happy and healthy. I'm Lynn Doyle for Meet the Doctors.